Now we want to go ahead and take you to Governor Tim Walz. He's beginning a press conference at this time. Let's listen in.
The COVID-19 pandemic. Today's a day that all of us have been looking for. I'm going to be joined today by Lieutenant Governor Flanagan, by Commissioner Malcolm, and then you're going to hear from three healthcare leaders, folks who lead, and they themselves have been on the front lines of dealing with COVID-19, but have been partners from the beginning, and that's what this has been, Minnesota, a partnership. Just a couple things of note. Today marks 1 year since the first patient started to show symptoms. At that point in time, we were scrambling. There were a handful of tests, mostly done by the CDC, to confirm this new novel coronavirus that had shown up months before in Asia and then, of course, in Europe. Here in Minnesota, it was 1 year ago, February 25th, 2020, and I recognize our lives have changed dramatically in that 1 year. At that point in time, we didn't know what we were dealing with. We didn't know how to treat it. We assumed but did not have personal protective equipment to protect our healthcare workers. We were fearful that we'd seen elsewhere hospital capacity be overwhelmed, putting people's lives at risk, both first responders and those trying to get health care, whether it be for COVID-19 or whether it be for just the normal things that happen in life. We didn't have the testing capacity, and we certainly weren't even in the beginning of understanding if we could have a vaccine. And during that time, there's been tragedy. 6,450 Minnesotans have lost their lives. 500,000 have had it, and 25,000 have at times been hospitalized from pretty bad cases to life-threatening cases. We've shared that grief. Lieutenant Governor very early on lost her brother. The Attorney General lost his mother, and each of us has a story of loved ones or neighbors or friends who've lost their lives to COVID-19. And then we stood in front of you and asked, let's do this together. Let's fight this thing together. Let's learn what we can do. Let's do the things to slow the spread of this. Let's do the things to protect our healthcare workers, to protect our seniors, and to a time, and I can remember saying this, at some point in the future there will be a vaccine. Well, that point was about 56 days ago when it started arriving in Minnesota. And our case numbers now, and we'll talk a little bit about it, are dropping. They are dropping rapidly. Our death rates are dropping rapidly. And because of what you have done, you've kept Minnesotans safer and you've kept Minnesotans alive. We followed the science. We made tough decisions. I want to be very clear. This has been painful. It has been painful from a health perspective, it's been painful from an economic perspective, and it's been painful from a social and mental health perspective. We talked this whole time about how did we measure the health benefits, the economic benefits, and the well-being, and how did we find that Venn diagram where we got in the middle, where we protected as many people as possible and protected our way of life. We missed holidays, but I'm telling you, we saved lives. One of the things we hear, and I want to just be clear, I talked with a good friend of mine the other night, the governor of Kentucky, Andy Beshear, and he talked about as we measure with states, we've got to get to a point in this country where we realize every single one of our neighbors and every single one of our fellow Americans is part of how we try and reach herd immunity and how we try and protect each other. It doesn't do any good if we're not able to do that. But I just want to be very clear. This shows the rise of COVID cases by states, and it shows our surrounding states. And this has been certainly nothing that people haven't seen. Certain states took certain different steps on this. And I want to show you where those lines start peaking right before you see the yellow line in November. That was in October when we were saying and listening to the healthcare professionals, some of whom you'll hear today, is if we don't change the way we're doing business, we're going to have a spike that is going to overrun our hospital systems. If we don't make a change, we're going to see more deaths. And that's where we started to make that change. That peak did not go as high, and it came down faster, and it's where it's at. That graphic is something that I am proud of Minnesotans. I'm proud of our healthcare professionals. I'm proud of the scientists who made the decisions to make some of these changes, because the higher that line goes, the more people end up in the hospital. The higher that line goes, the more people that die. But here's the deal. It's working. And the vaccine is working, I think, maybe even better than we could have hoped for at one point in time. Cases, hospitalizations, death are at their lowest level than they've been in several months, in some cases clear back to last spring. Long-term care deaths have fallen by 97%. This was the tragedy across this country and across the world, that COVID-19's impact, especially the deadly impact, fell most heavily on our seniors, and it fell most heavily on seniors in congregate living facilities. And we have thousands of those in Minnesota. And 95% of long-term care facilities are not only controlled it, not only reduced their deaths almost to zero, they're open, and the joys of life of seeing grandkids and seeing family members is once again back with them. So what you can see here is this is since November. When we made those decisions and asked you, with the guidance of science, leadership in the healthcare community, to make those changes, this is where things have dropped off. This is where we stand today. We've got nearly 100% reduction in just those 2 short months. That's because of sacrifice that people made, that's because of masking, and that is in no small part because of the vaccine that is there. Whoops. I also, in December, asked you to make those hard choices to let us get the vaccine going. Remember, it was about the 22nd of December we saw our first cases being able to vaccinate, those that were on the front lines of healthcare and in our long-term care facilities. But I also said the sooner we were able to control the spread of the virus, the sooner we were able to take the pressure off our healthcare system, and the sooner we were able to get as many vulnerable seniors vaccinated as possible, we have to get our students back into school. 88% of districts and charter schools are back in some level of in-person learning. Lieutenant Governor talked about her beautiful little second grader has been back for some time. This week, my 8th grader is back in-person learning. And I can tell you as a parent, life is so much better for them, and it's certainly so much better for us because we're seeing them re-interact, we're seeing them get that instruction from their professional educators, and the one thing that we all know, that social emotional learning that's part of school is coming back again. We've got a nation-leading education testing program. All teachers have access to on-site testing in their schools every 2 weeks. We're encouraging to get that in the community. It's as robust and as barrier-free in Minnesota as any state in the nation. And we've already vaccinated over 90,000 of our educators who are back in doing that hard work and at the same time making sure they're safe. And here's where we buckle up, and this is the time I would say, I used the marathon analogy. This is time for us to dig deep and let's finish this thing. The end is in sight. We can finish this. We can do it the right way. And daily number of doses administered has doubled since we put timeliness goals in, and our providers stepped up and told us what we needed to do for them to make it so that they could get those vaccines out to people as quickly as possible. We've got a reliable federal partner who's committed to delivering stable and growing vaccine supply. You heard the announcements, and it'll come on officially here, Johnson & Johnson. Vaccine works. It's 1 dose. It's shelf stable. We don't need to keep it at 90 degrees below zero, which means we're going to have another stream of vaccine coming into the state very soon. So the finish line's there. Let's finish this thing, and here's how we're going to do it, Minnesota. We understood that when we did this, we had to protect our seniors. It means that that commitment has been there from the beginning. It remains there today. 90% of our COVID deaths have come from 65 and older. It's the nature of what COVID does. In 12 months, 1 in 200 people age 65 have died from COVID. It is not the flu. It was never the flu. It was always serious. It remains serious for many people, but those numbers that are most dramatically impacted have been reduced because of mitigation efforts and the vaccine. We prioritize them in the groups immediately for vaccines in January and continue to do so. We've built a network of providers. You're going to hear from them. This is not the state. The state cannot do this. There is a robust ecosystem that allows you to get your vaccine in the easiest way possible. You should be able to get it with your doctor if that's easier for you. You should be able to get it at the local Hy-Vee or the local CVS. You should be able to get it at a clinic that you use. Or if any of those things don't work, the state has stepped up and put out pop-up sites and some permanent sites where you can go in and get them there, meaning barrier-free at no cost to you and try and get you in as quickly as possible. I want to stress, Minnesotans, we can't do it fast enough. I'm on calls about every other day with governors. Every single governor in this country is hearing the same things. Why can't we get it out faster? Why am I waiting in line? Why does it seem confusing? And it's simply a supply and demand issue, folks. We simply, at the beginning of this, we were being told a certain number. It was hard to get stability around it. We had about a 5-day lead time that we could get that, and then we were getting about 60,000 a week. Now think about that number, 60,000 a week, and our goal is to vaccinate about 3.53 million Minnesotans. At that pace, it would have taken us years. It was predicated on adding more vaccines to the system. I'm proud to say now that since the 1st of February, we've been getting a 3-week notice, and each of those weeks has increased in what we're able to get. The minute we're able to increase, our providers have been getting 90% of the vaccines out within 72 hours of when they land in Minnesota. And as you saw last week, if they happen to land in Texas, somebody's going to figure them out in the next 10 hours to get them back to Minnesota and in arms in Fergus Falls and in Thief River Falls and in North Mankato. That's what's going on right now across an entire rich ecosystem of thousands of providers. We've got 43% of our seniors done as we stand. As we speak, that number will kick up. And I believe as we speak, Jan, this will go live on the dashboard for you to go in and see this tick up as we move that number higher. By the end of the month, we've completed vaccinations in long-term care, clinics, hospitals, federally qualified health centers, pharmacies, local public health, and our state vaccination sites all work together. Our site where you can go in and the navigator and find out where you're at and where you can get them, those are up and running. But here's the thing.
You've been listening to Governor Walz speak about Minnesota's path forward when it comes to COVID-19 vaccines. He hopes to ensure 70% of Minnesotans 65 and older get vaccinated before offering the vaccine to other groups besides teachers and child care workers who are already eligible. You can watch the rest of the governor's press conference on CBSN Minnesota. Stay with WCCO online and tonight on our news at 5, 6, and 10 for more updates.